In other news, the DA says the national health insurance legislation in its current form will be catastrophic. The party plans to, within the next 30 days, legally oppose its implementation. Now, as you know, President Cyril Ramaphosa ratified the bill yesterday, despite widespread protest.
The bill fails immediately on the basis that the provision in the bill simply cannot implement due to many various reasons, such as poor service delivery, lack of staff, lack of maintenance in our health facilities, and the consideration that the poorest of the poor will have to meet extremely strict requirements in order to access healthcare in terms of the NHI. The bill is also poses mass areas that are a real threat to tender corruption, fraud, looting, and to the fund.
Well, joining us this afternoon to continue the discussion and the many discussions I imagine will follow on NHI is Eleanor Becker. She's a senior reporter at City Wire, and City Wire is a media group covering the global asset management industry. Eleanor, it's great to talk to you. Thanks very much indeed for coming on, and thank you for your patience as well. You've been writing quite extensively about NHI, and you've actually given a timeline from 2023, November 2023. What's important about that time frame from November last year to the signing yesterday?
First, thank you for having me. I appreciate it. So around the beginning December, National Health Insurance Bill was passed by the National Council of Provinces. We then knew that NHI was going to be a feature. And then during his State of the Nation address in early February, President Cyril Ramaphosa said he would soon, be signing the bill into law. And then government, we had our budget, our national budget, but the allocation to NHI was relatively minimal. And nothing was said about its potential funding sources. And then on Monday, government announced that the bill would be signed into law, which, as you know, was signed yesterday.
Yeah. Have the new taxes been outlined as yet? You said during the budget speech earlier this year, there was quite there was sort of a small amount of money that was allocated, but have we outlined exactly what the taxes will entail?
So it's complicated, as all government things would be, but the finance minister needs to first introduce a money or a funding bill in Parliament before NHI funding is made clear. And then that would possibly introduce tax amendments and other sources of funding. Mm-hmm. We do know in the NHI Act, according to Article 49, that the money may come from a general tax revenue, shifting funds from different departments into the fund, possible reallocation of funding from medical scheme tax credits. I'll get back to that now. Payroll tax, that's, tax for you and me, or surcharges on personal income tax.
Yeah.
These would all be introduced by the money bill.
Yeah, so obviously you won't be getting that that relief in your annual tax return insofar as your medical aid is concerned. It's very interesting to hear not only the President talk yesterday, but also the Health Minister about how medical aid is for the rich, it's only for those who have the money. Where public servants themselves are on GEMS, they are on medical aids. What do you make of that? For me, it sounds like a sort of a polarizing way of trying to sell the idea of NHI.
I'm not going to get myself into trouble by commenting too much. Look, I can only speculate, but I do know that the people that are on medical aid feel that they need to be on medical aid to get adequate health provision. We know what the states of public health is. GEMS, for example, apparently is one of the very well-run medical aid schemes. I'm not sure how their members will feel about medical aids being restricted in the future.
Yeah.
But we've heard from the medical aid industry, medical aid scheme industry, and they've said not to panic. They've said that we should keep paying for those of us who are lucky enough to be on medical aid, to keep paying our benefits, our fees. The benefits are not going anywhere. it's likely to take forever, or at least in the next 10 years to implement. And that there's no immediate threat anyway, in the short to medium term. But I can't comment on GEMS and the government-funded medical aid schemes.
You'll forgive me for trying. So what's been the reaction? What's been the reaction from the industry? You've said that medical aids have said, we're not going anywhere. There's still a long road ahead. Keep paying your fees and so on. But has there been any kind of impact, for example, on their shares with the signing of the bill yesterday?
So interestingly, I think when the news broke out on Monday, it came as a surprise to quite a few people. And I had a look at some of the shares. So medical aid schemes themselves are NPOs, non-profit organizations, but their administrators may be listed. So one example is Discovery, and another would be Momentum. Both, as well as a hospital group, Netcare, both all took quite a hit on Monday. And then steadily their shares started recovering over the week and were actually pretty recovered by yesterday on the signing. So I think maybe just I'm not an expert when it comes to the market, but I would imagine just the certainty of knowing we have this bill now and there's a process in place going forward.
And now
is better than the uncertainty.
Yeah, and now we wait, right? We wait for the various legal processes that are surely set to unfold.
Yeah, as you mentioned, that there are quite a few people who are very unhappy with the state of the bill. I think most medical aids and probably most people in the industry are supportive of universal healthcare. We definitely need it in this country. But the state of the bill in how it's written and how it affects medical schemes going forward is their issue. And that is what needs addressing. And they've said, we've heard from various industry bodies, from opposition parties, from healthcare institutions and associations, that they plan to litigate. So we wait.
Eleanor Becker, let me thank you for your time this afternoon. Eleanor is a senior reporter at City Wire. She's been writing quite extensively on NHI.